So symptoms of endometriosis, some women may find that they have really painful periods. This can be debilitating pain where, yes, they need to take 5 days off work every month. If you have to do that, one hopes that you don't get fired, but that is a reason to go see your doctor. Some women may find that they find sexual intercourse very painful. They may find that they not only painful periods but heavy periods.
Hello and welcome back to another podcast episode with a Reformed Mindset. My name is Juliet. Over here, we help young women overcome self-limiting beliefs, heal from trauma, challenge the status quo, and step into their full potential. Today, I've got an amazing guest with me, and that is no other than Dr. Ibironke Tayo.
Hello,
Really lovely to have you here today.
thank you for having me.
Oh, I'm so happy to see you. Dr. Ibironke is a doctor in obstetrics and gynecology with over 8 years of experience. Today, we are going to be talking about some of the issues that a lot of women out there face, and that is on endometriosis, PCOS, and the silent struggles women face. A lot of women started noticing symptoms just before 30, some of them after childbirth, and some
Mm,
people were also told that every pain or symptoms they've been undergoing,
mm,
it's absolutely normal. So we are going to be unraveling some of those symptoms and hearing from a medical
mm.
perspective if what we've been told is normal is actually normal or not. Are you ready to listen to that? Let's dive right in, Dr. Ibironke. So I'd love to hear from you. What was the inspiration or motivation behind you becoming a gynae? Was there like a personal experience, or was it something that you saw that has, made you like devote a good part of your life towards
Mhm.
helping other young women out there?
Yeah, I would say it's multiple reasons why I chose obs and gynae. So, going to school, I was very science based, very mathematical. However, I did have a personal experience. One of my earliest memories was of my mum. She's given me permission to say this online.
Yeah.
When I was 3 years old, my mum actually had a near-death experience from a miscarriage, um, which I witnessed before she was taken by ambulance to a hospital to have treatment. So that was one of the memories that really stuck to my mind. And I think from quite an early age, I knew that I wanted to do medicine, but not just medicine, but go into obs and gynae.
Oh, that's really, really incredible and lovely
Mm,
to hear that from you. So, I would love to hear from you, concerning our topic
mm,
today on endometriosis and PCOS. A lot of people out there,
mm,
we're not used to, or we don't even know what these
mm,
conditions actually, what is really all about. I would love to hear from you. How would you, you know, explain or describe endometriosis and
mm.
PCOS to someone who has not got a medical background?
Yes. So endometriosis, PCOS are two conditions that we treat in gynecology. If I start with PCOS, so PCOS, we kind of cross cover with other specialties like endocrinology because it's a metabolic and a endocrine disorder that not only affects the women from a, let's say, reproductive point of view, but it has long-term consequences on a woman's life.
Mm,
Um, it So we have what we call is a criteria that we follow in order to diagnose it, and this criteria looks at specific symptoms and signs that we can see via various tests that allows us to diagnose PCOS. Now, if we kind of compare that to endometriosis, um, if I talk about the similarities, both of the conditions are lifelong. There isn't a cure, as they say, for the conditions, but there are ways that we can help to manage the symptoms because they can be quite, um, they can affect someone's quality of life significantly. Um, when it comes to endometriosis, that's a condition where in if I say in very simple terms, is where you can find lining of the womb tissue anywhere else in the body.
Mm.
So, as you can imagine, if there's lining of the womb anywhere else in the body, when you go through your menstrual cycle, that bleeds as well, which then can come with various different symptoms.
So how does it, when you say you find it anywhere else in the body, like, is it that it's meant to be at a specific spot and it's
Mm,
migrated to somewhere else?
mm.
What's actually causing that?
So, there used to be old thoughts that it was due to period. When you have your period, there's blood goes back into your abdomen.
Mm-hmm.
However, the specific cause of endometriosis is still under lots of research. We don't particularly know a lot of reasons why women get specific conditions. Unfortunately, women's health is one of those areas where there is lots of research, but if we compared it to other specialties, it's not. There's not as much research
Mm.
compared to
And
other
why
specialty.
why is that? Why are we not having people or researchers looking more into some of these conditions that women face?
Um, I guess we have to ask researchers.
Interesting. And for people who are listening, can you like explain to us like what
Mm.
does PCOS mean in full?
Yeah. So PCS means polycystic ovarian syndrome, um, but we call it PCOS
Okay.
for short.
Okay. So are there like certain lifestyle, choices or habits that we do that
Mm.
actually triggers this? Or are we just born, some of us are like born to either have PCOS or you don't have it?
Um, so if you're asking me about the root causes of the conditions, so for these two conditions are conditions that can happen sporadically. For some women, yes, it runs in families, but there isn't if we kind of compared it to another condition, which people may know, like sickle cell, it's not that type of condition where it can run in families because it's passed through the genetic,
Mm,
um, through people's genes, which is your genetic makeup when
yeah.
we're talking about DNA. Um, these two conditions, there's multiple factors that kind of play a part in how people develop it. And in majority of cases, it's not particularly clear why some women will develop it and why some women do not. Um, we know that we can see it in particular populations, especially when we look at PCOS. But we haven't got to the point where we're like, oh, it's a specific gene or there's a specific reason why some women
When you say
develop it.
particular like population, can
Mm.
you elaborate more on that, please?
So when it comes to like PCOS, when we look at population statistics, so different um, countries will do their own research and to how many women in their countries have the condition, and then they will look into the demographics of their population. So, for example, it would be South Asian women are more likely to have PCOS because we see it more in that population. When it comes to endometriosis, we see it throughout the board. There isn't a specific population.
Hmm. So let's start from the basics of it because I know like PCOS, endometriosis, these are things that, f- from my own understanding, affects like our menstrual cycle.
Mm.
What is considered a normal menstrual
Mm.
cycle and what is abnormal?
Yeah. So a normal menstrual cycle, we kind of have what we call is two phases. We have the follicular phase and we also have the luteal phase. So the follicular phase is where your ovaries, or people know them as egg baskets, um, they go through a cycle where they pick out a specific egg that's going to mature. And that's what happens in your follicular stage. At that same time, the lining of the womb gets thicker in preparation for when the egg gets released. And if it gets fertilized, then it will implant into the lining of the womb.
Mm,
Um, but if we normally would say that a normal menstrual cycle is around 28 days, it can go up to about 35 is a normal cycle. Um, in that kind of normal cycle, you're not expecting to, most people will have a period where actually, yes, it's something that they have, but it shouldn't cause them debilitating symptoms. Um, and then in your luteal phase, if an egg doesn't get fertilized, you then go through menstruation. And once you have your period, you would then restart the cycle. And lots of hormones play into this in terms of how the cycle goes,
Okay.
and your brain chemicals as well.
Okay, because I've seen some women, because my high school, we were just
Mm,
girls in my senior high school. And during that phase, we had like different people,
mm,
different circles. Some
mm,
women, their
mm,
menstrual cycle is like 21 days. And for some people, it gets to like 45 days.
mm.
Is that considered normal, or it's going towards the abnormal end of the spectrum?
Well, when we say normal, so yes, 20 between 21 and 35 days is a normal cycle. But what we particularly, um, if your period is going above 35 days, we will normally say actually your periods are, um, we call oligomenorrhea, which just means you're having a few periods per year. And there can be a cause for that. But in some women, that is normal for them. But that's why we normally ask a full history from a patient before we say whether it's normal or not.
Okay, so with the oligomenorrhea,
Mm,
now you said for some people it's normal and for some people it's
mm,
oligomenorrhea.
yeah.
I hope I pronounced
Yeah,
that
yeah,
well.
that's correct.
So how do you know, like, if what I'm having is normal or if it's oligomenorrhea?
Yeah. So, um, if we kind of just look at a woman's full reproductive life, when you first start your periods are quite erratic. So you may have a period one. Some people, they start their period and it's regular from the beginning. For some people, they may have a period every so often. So we kind of say the adolescent years is quite normal for the periods not to be very regular. However, it should improve once they have their periods for a number of years. It's like the body's just getting used to having a period.
Mm.
Now, once you get, let's say, most women will start their period around the ages of 12 up to 16. Um, for some women, if we're looking at their kind of family history, if everyone in your family has always had a late period, for some people that's due to a condition. um we we kind of just have what would I say, we have classifications where we think, okay, there needs to be more investigation before we say it's normal. So if you're a 12-year old, let's say you're a 16-year-old and you still haven't started your period, those are the kind of the people we want to go and see their doctor, especially if in your family this is um uh something that doesn't happen. Does that make sense?
Mm.
If you first started with a regular period and then there's a significant change to it, then yes, that's why you need to go see a doctor. Um, what else would I say? Um, if you're noticing it, it can be slightly common in teenagers, particularly, that periods, because of the irregularity of it, and also um, their body just getting used to having a period, may have either periods which um, are, they may think is heavy, or and we would also say that's heavy, or really, really painful. So if it's affecting your quality of life, that shouldn't you shouldn't have that in any stage of your life.
Okay, that makes a lot of sense. So for a woman who she's gone past adolescent phase, she's no longer a teenager, maybe she's in her mid late
Mm.
20s or even 30s, and she's noticing that her cycle is going from maybe 35 days is now 40, 45 days. Is that a cause for alarm? Does she need to go see the GP or?
Yeah, I would say yes, you can see your GP, especially if it's causing you significant issues, because there could be a condition behind why that's happened.
Mm,
And most people will kind of figure out that once your periods are prolonged, particularly if you're getting a period every 6 months, when the period does come, will be significantly heavier because actually you've had 6 months where the lining has continually grown, and then you're now going to get a bleed to get rid of that really thick lining. But our main concern, and the reason why those ladies, I would recommend that you go and see a doctor, is because there can be various different conditions why that is happening. And it's better to find out where it can be treated than it to be anything more serious.
yeah. You talked about a debilitating pain. What is considered a normal, like, discomfort, and what is considered a debilitating pain? Because I remember back in high school, I used to have this classmate. Whenever she's on her period,
Mm.
she's going through excruciating pain. Like, she's rolling on the floor, she's crying. And for us then we felt like this is normal. Like, it's normal. So when
Mm.
at what phase would you say, okay, now this is no longer a normal period pain. There is something really going on in my system.
So if we kind of go based on what you said in terms of the person you saw in high school, if you're having a period where you need to stay at home, you can't concentrate at school, those that's not a period that's normal. Um, Everybody has a different pain threshold, and even if I kind of can give a caveat for that, some women may think actually this is normal for me. um I use super plus tampons, and I've always used super plus tampons, but if I'm feeling really tired with it, I can't get up or do anything, I feel very fatigued. For some women, they get really severe um, what we call is premenstrual symptoms,
PMS?
then those are the kind of people that I would recommend to go see a doctor. So if you're taking regular painkillers, paracetamol, ibuprofen, and your pain is not under control, yes, for some women this can be normal, but in majority of cases, if you can't get your pain under control, that's a reason to go see a doctor.
Mm. That's really interesting to know because for some of us, we've been told that, pain is normally associated with your period. And sometimes we've been dismissed when some women, when they are seeing their period, they are going through pain and they're like, you're overreacting. Like, this is normal. But I think
Mm,
society,
mm,
they have a way of trying to minimalize
mm,
the struggles that women go through. I think a while ago, there was something circulating on the internet where a man made a comment and he said something like, women are kind of like overreact when they see their periods.
mm.
That shouldn't be a reason why you should treat people poorly. Of which somehow I feel like generally we shouldn't treat people poorly. But do you think when it comes to a woman's menstrual cycle, because sometimes you hear women say that, oh, my hormones are making me act up, I'm getting
Mm,
angry, I am behaving in a way that is not considered normal for me.
mm.
Do you think women are what's the word to use now? They are overreacting.
I wouldn't say women are overreacting. If we kind of look back at the history of medicine, um, and this plays a part in terms of the words we use for women's uh, surgeries and uh, particular surgeries, they used to call the menstrual period hysteria. That's a Latin word. So I wouldn't say having significant mental health issues or significant emotional issues during your period. I wouldn't say that was normal. You should be able to have a normal life where it's not affecting your quality of life.
Hmm.
That is what I classify as a normal period.
So for someone who doesn't, maybe you're not having pain, but you're having random mood swings, you're getting angry easily. Do you think that's a cause for you to say, okay, now I need to see a doctor?
Well, No, so you're due to the hormonal changes, you can get emotional.
Mm,
However, we are talking about people who have very exaggerated emotional experiences. So you get women who say, actually, during my period, I become very suicidal
oh,
or I become very aggressive. My husband can't stay with me. I can't deal with any of my children when I'm on my period. I become very violent. Uh, those are extremes. Does that make sense?
mm,
Um, the reason why I come back to the whole quality of life, if any of your symptoms are causing you to have a lower um, quality of life, then yes, I would say seek a doctor. There's no point continuing at home and suffering.
yeah, because sometimes like depending on where you find yourself, like the kind of society, the
See,
cultural
yeah,
norms, that would actually determine what
is
result
normal.
you get
Yeah.
exactly. Because, I mean, in some parts of the world, you go to the hospital and you're like, my period is just making me feel very irritated. I feel bad. And you could sometimes be dismissed. Like,
Mm.
you're not the first person to see see your period. So that's not serious. Like, just go out and you don't get treatment for it.
Um, I would say that when it comes to periods, yes, periods are normal, but there is an abnormality of periods, which this is why we are obs and gynecologists. That's what we treat. Um, and it's sad that people experience dismissal, but I wouldn't say, I think it's very important to be your own advocate. And if you don't feel heard, to find someone who does hear you.
Yeah. So what treatment options have you got for people who are experiencing this sort of like excruciating or debilitating pain?
Yeah, so there's various different treatments, and if you do see a clinician, we will normally go through the benefits of the risk of each treatment,
Mm,
why we suggest the different options. Um, in majority of cases, yes, it depends on, is this affecting my quality of life? Do I want to change? Um, and we would, all our symptoms are to treat your symptoms. It doesn't necessarily treat the root cause. As I said, PCOS, endometriosis is a lifelong condition. So there isn't although um, there are things we can do, but there isn't a cure per se that's going to just wipe away. Um, we there isn't a cure for the condition. So in terms of treatment options, we will normally start with um, what we call is non-hormonal treatments. So for some women are very sensitive to hormones. The aim of hormones is to regulate your menstrual cycle so that hormones will now take over your menstrual cycle rather than your normal. It will suppress your normal bodily system. Um, when it comes to non-hormonal, we have two different kind of drugs that we can use. So we can use a stronger version of what we call is ibuprofen, and we call it mefenamic acid. And this helps to not only reduce the pain, but also reduce the flow, and also reduce specific chemicals that get released that causes the significant pain, and also can cause digestive symptoms.
yeah, that's good. So you said non-hormonal and
Mm.
hormonal. So for the hormonal bit, what do you use?
Yeah, so for hormonal treatment, we would normally use a various different forms of hormones. So people will also know these hormones as what we use for contraception. And we also use it for various different other female conditions. So we have things like the progesterone only pill. So this is a pill you take continuously. Um, that's one option. We have the combined oral contraceptive pill. Some women take it 3 monthly, some women take it for 3 weeks, then you have a week off. Um, s- Other treatments are like the implant that sits in the arm, or you can have what we call is the injections, which we call Depo-Provera, or you can have what we call the coil. So the coils come in two versions. There's the non-hormonal coil and there's the hormonal coil. When we talk about hormonal treatments, we call that there's different versions. There's the Marina, which we also use. And we normally recommend the Marina for specific conditions as first line.
Oh. So are there like side effects, long-term side effects, or even short-term side effects to taking either the non-hormonal or hormonal medications?
So from the non-hormonal, they will, with all drugs, there's always risks and benefits. Nothing is risk free. If we start with the non-hormonal, so when it comes to mefenamic acid as one of the drugs, that if you're someone who has acid reflux, or you have, some people say I have a hiatus hernia, then that's probably not a treatment for you because that can affect that condition. Um, Also, it can cause stomach upset, which means that people um, won't get on well with it. So we normally, with any form of drug, we normally give a trial to see how you get on, and you will normally know in majority of cases 3 to 6 months, how is my body getting on with this drug or not.
Yeah, okay. So my team and I, we recently carried out a survey to
Mm,
find out what women, some symptoms they get to experience in their
mm,
menstrual cycle. And one of the survey questions someone said to me was that after she started taking the contraceptive pills, her period has not returned back to normal.
okay.
Why is that happening?
So for that particular lady, I don't know her particular circumstances to talk about her, but the when it comes to the pills particularly, once you stop it, your menstrual cycle should go back to normal.
How soon?
uh Pretty much once you stop it, it depends when you stop it in your menstrual cycle, but if you take in the 3 weeks and then you're now on the week off where you have a period and you don't take the pill anymore, your fertility returns back to normal.
Yeah, okay. Now going back to PCOS and endometriosis, is it possible for a woman to have both symptoms or both conditions at the same time?
Yes.
So how do you get to like distinguish what exactly is
Mm.
causing what?
So um when it comes to the particular conditions, there are specific symptoms and there are specific signs we will see, or if we did specific investigations, we will find different signs that points to that condition. If I kind of give PCOS as an example, someone may come in and say, actually, my periods are every 6 months. Now, that's not normal. That's one of the symptoms.
Yeah.
You may say, oh, I have lots of hair on my body, I have to shave my face every week. That's not normal when it comes to PCOS. And that can have a lot of effects on someone's esteem and
Understand.
psychological, can have a huge psychological impact. um, you can have severe acne, which can be very life altering. You may notice that your doctor says, oh, go and have these set of bloods. And there's a reason why we say that, because we want to know, is this PCOS or is this any other condition that can cause similar symptoms?
Yeah.
And then with those tests, your symptoms, and also we would ask for you to have a what we call is a transvaginal ultrasound to have a look at your ovaries, because in PCOS, you can have what we call is polycystic ovaries on an ultrasound, but this doesn't necessarily mean that you have PCOS. However, one of the criteria to diagnose PCOS is that you can have polycystic ovaries on ultrasound.
So are you saying that polycystic ovary is different from PCOS?
Yes.
can you like shed more light on that now? Because I'm so curious to like,
Mm.
what's the difference between the both?
So, if we looked at lots of adolescents, we will find that a lot of them, depending on where they are in their um, if they started their periods and they haven't started their periods, a lot of them, if we scan them, they will have polycystic ovaries. But actually, it's not polycystic ovarian syndrome. That's just um, what's these. It's a misnomer in terms of it's not lots of cysts on the ovaries, but it just means lots of follicles we can see on ultrasound that don't develop. So this is why someone doesn't get a period each time, because there isn't, what normally happens in the menstrual cycle is that the ovary picks one specific follicle that it matures and then you get egg release. But in polycystic ovarian syndrome, for a lot of women, they don't ovulate, and therefore this is why they don't get a period.
Oh, so is there a reason why the eggs don't actually develop?
For that condition, that's specifically what happens because of hormonal imbalances.
So are there like certain lifestyle changes or habits that we can take on?
Mm,
Because we did a survey on this, and a lot of women talked about how PCOS has
mm,
impacted their mental health.
mm,
Some of them feel that they've done something wrong,
mm,
especially with what society also has to say about it. Because I asked, based on the survey, we asked them, what are some of the common myths
mm,
that you've heard about PCOS? And one thing that stood out amongst everything they've said is that any woman who has
mm.
PCOS is prone to infertility. She's never going to get pregnant. Is
Um,
that true from a medical
hmm,
perspective?
that's a good question. If you have PCOS, it does not mean that you are infertile. Um, it may mean that you are subfertile, meaning you may find difficulties in getting pregnant for some women, not all women with PCOS. Um, but yes, both conditions can affect fertility, but it does not necessarily mean because I have this condition, I'm going to be infertile.
Good. So we coming back to the question about this PCOS now. For women who, how do they get to know if that's going to affect their future fertility or not? Just to
Mm,
keep their mind
mm,
at rest that, okay, yeah, this is not, might not be my case.
mm. So if I kind of talk about the NHS and how the NHS works, so we kind of treat symptoms, we treat signs, we treat particular conditions. We can predict certain things, but in terms of predicting fertility, the only way to predict it is to try to have a baby and then see what happens.
Mm.
Now, one of the things that we can test is we can test specific um, uh, hormones. One is called AMH, anti-Mullerian hormone. Um, However, that doesn't necessarily tell us that you are going to be fertile or not. Does that make sense?
Mm.
Um, so, in terms of how do you find out whether you're going to be able to have a baby, is to try to have a baby. And then if you notice after 1 year you're not getting pregnant and you have a diagnosis of PCOS or endometriosis, then go see a doctor.
So
And mm,
endometriosis as well, also, does that also have an
impact.
impact on
Yeah.
our fertility?
Yes. So endometriosis also has an impact on can can have an impact on fertility. We tend to stage endometriosis. Um, and the problem with endometriosis is that symptoms doesn't necessarily match the staging of endometriosis. And also whether you can get pregnant or not doesn't necessarily match the staging either.
Okay.
However, we would normally say, particularly if we look at endometriosis, that if you have a condition of endometriosis, everything happens to go that the younger you are, um, don't leave fertility to later later on in your life. So if you're in your 20s and you really want to have children, or you're in your early 30s, it's not to say that over 40-year-olds don't get pregnant. They do,
Okay,
okay?
okay.
But the earlier you are, because then they become what we call these confounding factors, and age is the most common thing that will affect your fertility. So even with these conditions, um, the earlier you try to have children, then there's things we can do to try and help with any fertility issues that you may have.
Okay. I've got two follow-up questions now.
Yeah.
You've listed some of the symptoms of PCOS.
Mm.
What are the symptoms of endometriosis? And when you talk about staging,
Mm.
what are they as well?
Yeah. So symptoms of endometriosis, some women may find that they have really painful periods. This can be debilitating pain where, yes, they need to take 5 days off work every month. If you have to do that, um, one hopes that you don't get fired, but that is a reason to go see your doctor. Um, some women may find that they find um, sexual intercourse very painful. They may find that they um, not only painful periods, but heavy periods, significantly heavy, where you get flooding despite using normal sanitary wear. Um, Flooding where you're changing your pad every hour, every 2 hours, where you're feeling really dizzy, you're feeling very weak. Those are symptoms that we will normally say is can be
Do
endometriosis.
they get iron deficient?
If you particularly have heavy periods, you can become iron deficient.
Oh, okay. So what are the staging you talked about with endometriosis?
Yeah, so with the staging, this is normally when we look at the extensiveness of the endometriosis. um that's how we stage it. So we may see a few spot, like if you we've gone away from this, but usually if someone comes to clinic, you may get what we call is a keyhole surgery to see if you do have endometriosis. Now, on that keyhole surgery, we can then stage the how bad the endometriosis is. So we can say stage one, maybe just very small spots in where it shouldn't be, meaning we shouldn't see the lining of the womb anywhere else. But if we're seeing lining of the womb significantly, um, if I compare that to stage four, where it can lead to abnormal connections between the organs, the ovaries start to stick together, there's cyst on the ovaries, then we would say, and it gets stuck to the bowel, we would say that's stage four.
Oh. So do these conditions, when you talk about stage, because like what I'm used to hearing when they talk about stages is
It's
like
cancer.
cancer.
Yeah,
Yeah,
yeah, yeah.
exactly, like it's cancer. So is there like a probability that at some point it'll become cancerous, or is it something that's non-cancerous?
So endometriosis is non-cancerous. So no matter how bad the endometriosis is, it's not going to be cancer. But if I kind of flip that to PCOS, so PCOS is a condition, as I said, it was an endocrine condition, and it's actually a metabolic condition, meaning it can have long-term consequences, or complications can arise from that condition. So this is why it's very important that if we do diagnose it, so that we can put in not even just treatment, but inform you of the complications that can happen with PCOS. One being, yes, there is a risk of cancer, especially if you're not having periods regularly.
Hmm.
Um, there's a stage even before cancer that can happen. And this is why if you're not getting a period, particularly for someone with PCOS every at least 4 periods in the year, it's very important to see a doctor.
Mm. So at what stage does this move from PCOS to cancer? Is it like after a very long term, or is it something that can happen like,
It can happen like that.
oh my
So
goodness?
Well, not like that, but but I take that back. So it's more, if you're not getting periods, it's important to have periods. Um, I can't stress that enough. So unless you're on some form of hormonal treatment that's stopping your periods,
Mhm.
naturally your periods shouldn't stop unless you're pregnant, of course. Um, so or you're menopausal, meaning you've stopped your periods fully. Your periods is something that should be having clockwork throughout your life. So if you're not pregnant, you're not menopausal, you should be having a period. And particularly if you have PCOS, as I said, 4 periods a year is the minimum you should have.
Oh, so what about things like stress? Because I've had people say that, oh, when
Yeah,
you're so
stress.
stressed, it can like throw off your
Yeah,
period.
for sure.
Oh.
So if you, so I can give myself as an example. I went through a very stressful period of my life and I missed the period for 3 months. Now, my period did come back after 3 months, and I knew it was particularly due to stress. However, for me particularly, um, there are other conditions that can lead to that stress itself can lead to a condition.
Mm.
So it's very important that if you, let's say you miss the period and it's only one period, that's not particularly a bother. But if you're missing 3 periods, and I should put the caveat that if you are sexually active and you're missing your period, first thing that you should think of is, am I pregnant? But let's say you're not sexually active and you're missing your period. If you're missing one period and uh you can say, okay, that's fine. If you're missing 2 periods or 3 periods, that's not normal. You need to see
In
your,
a year.
yeah.
I know someone
Oh, together when I mean consecutively.
consecutively. I was
Yeah.
thinking it's like maybe you miss one in January, miss another in September,
No,
another
no,
in
no,
December.
no,
So that's not a cause for
no.
concern. Okay, because I know someone that she at the time she was about 20
Mm.
and she's never had a period.
That's not normal. If you're 20-year-old and you haven't had a period, um, that's not normal. And we would normally say that you should have seen a doctor quite early, around the ages of 16. So if you're not having a period, if you haven't had your first period by 16, which we call amenorrhea,
Mm.
see a doctor.
Oh. So what happens if now that you're 20, you've never seen the period? Has something gone wrong? Is it something that can be reversed or
It depends what's the cause.
oh, okay. And I recall when you mentioned about was it PCOS, you talked
Mm.
about it being associated with age as well.
So not PCOS being associated with age, but fertility,
Fertility,
yeah,
yeah.
being associated with age.
Yeah.
So young women are more likely to have children. By the time you're 40 years old, the success rate of having a child is way less than if you were 13 even, or 20.
Yeah, oh, that's actually like good. But for now, let's take it out of the women, let's say for men out there,
Mm,
how do we get to enlighten them to be able to understand this, you know,
mm,
different symptoms and probably be a bit more compassionate to the female folks when they talk about this? Because based on the survey that we conducted, most people said, one issue why they don't voice out what they go through is
mm,
stigmatization.
mm.
Some people, I think I'm just gonna read
Yeah.
what the survey,
Mm,
most of the women. So one of the survey questions was, why do you think many women feel ashamed, embarrassed, or afraid to talk openly about their menstrual or reproductive health? And some of the responses I got was because they might be judged,
mm,
society and culture, stigmatization that reoccurred a lot of times. No one wants PT and it makes you feel vulnerable.
mm,
Some people said because of men,
mm,
some people said because, I mean, they're afraid of being judged
mm,
and stigmatization as well. How do we get to create a culture or a society where women feel a bit more comfortable talking about the
mm,
conditions that they go through? Because a lot of women suffer in silence.
mm,
They're not able to voice out, this is what
mm.
I'm going through. So, how do we come to that point where women feel a lot more comfortable talking about some of those conditions they go through and probably seek help?
I would say that you know yourself best, right? Um, it's very easy to say that outside opinion doesn't matter,
Mm,
but for a lot of people, you do care what your family says, what society says, but actually, it's your life and you need to take ownership for your life. So I would say when it comes to stigma, I think we're now in the stage of the rise of social media, the rise of um, lots of doctors do podcasts on YouTube. There's so much information out there
mm,
that I do not see the reason why you should suffer in silence when you can get help. Uh, Notwithstanding that different societies means that getting help is a financial burden.
mm.
Um, However, I truly would want, if you are a woman, I wouldn't want you to think, what would your family say? It's for you to educate your family. If someone has, if we kind of think about it, another condition, if someone has diabetes, they're more likely to kind of say to their family, "Oh, I have diabetes." They feel less judged. But your period is not what makes you a woman. Does that make sense?
Mm.
Um, yes, it's something that we know that's as women, we have a period and that's normal for us. However, it's not what makes you a woman. And
Mm.
therefore, um, I would say speak up so that you can get help.
Yeah. And just following up from what you said about speaking up, one woman asked a question during the survey, and she said, one of the questions she asked was, why hasn't she been able to conceive again since after having her first child in 2020? What could explain secondary infertility in cases like this?
So secondary infertility, there can be many causes for it. Um, this is why you should see a doctor. So we can ask you several questions and do several tests to try and find out the cause of infertility. If I kind of give a brief overview of infertility, it can be due to the man, it can be due to the women. And for each, whether a man or women, it can be due to several reasons.
So for her, let's assume she's in a country where there's not a lot of advanced medical technologies that can help. Are there, like, just off the top of your head or from your medical perspective, what are some of the common causes of secondary infertility for a woman? Let's leave the man outside for now.
Okay, so secondary infertility, it could be that you have PCOS that can cause you secondary infertility,
Mm,
especially if your PCOS is now um, developing, or you have endometriosis that's now developed. You can have fibroids that's now developed and that's causing you infertility issues. It could be that you're now not having a period, and that can be due to a brain tumor in the brain. It does not necessarily mean it's cancer. Um, it could be, there's several different reasons why you may not get you may find that you're having infertility, subfertility issues. And notwithstanding, for some people, we can do various tests and we find nothing. And for those caveats, it could be, I'm a believer and I would say it's spiritual.
okay, that is totally fine. But one thing that I want to get you've talked about age, like fertility and age.
Mm,
Now, with PCOS, endometriosis, and every other
mm.
symptom that women go through, what key role does age play in them aside fertility?
Um, if we say, is age connected to PCOS or is age connected to endometriosis? No, not
Mm,
in that remit. But if we kind of put them side by side, um, once you get to the stage where you are menopausal, majority of any of these women conditions will all get better because your hormones are a lot lower, and therefore you don't get those conditions are not active.
Okay. That is very enlightening to know. So, are there like certain lifestyle changes
Mm,
that women who are currently going through PCOS
mm,
and endometriosis that they need to take? Are there certain diets they
mm.
need to eat? What can they do to help manage the situation?
So, um, particularly for endometriosis, lifestyle changes is particularly important. Um, Generally, when we say lifestyle changes, this means having a healthy diet, exercising, making sure that you're not smoking, drinking, which can all cause um, conditions, um, making sure you're not taking any recreational drugs. These are the kind of lifestyle changes that you can make. Particularly for PCOS, a lot of women will find that actually weight loss is a problem when you have PCOS. And a lot of women with PCOS, you get some who are lean and then some
Mm,
are who have a significant weight. It's very important that trying to lose weight is a priority, because losing weight, whether that's using medicines, there's the rise of drugs like Manjaro and stuff like that. Um, it Losing weight, particularly if you've lost 5% of your weight in PCOS, this can improve fertility,
mm.
can decrease your risk, um, which there's risk with being overweight on
Yeah.
its own, not even adding in the PCOS. Um, I previously talked about how there's complications of PCOS, and I mentioned cancer as being one of them. But actually, when it comes to PCOS being metabolic, um, yes, you are at risk of having type 2 diabetes, having heart problems,
Mm.
having high lipids, so like things like high cholesterol,
What?
um, and these can have long-term consequences. You can be a 50-year-old who has a heart attack that isn't normal.
Mm.
So helping yourself by losing weight, not keeping a healthy diet, exercising, this has significant benefits, not just from doing those things, but also has significant benefits when it comes to the condition itself. You will hear people who say, I lost weight and I reversed my PCOS.
Yeah, I've heard that a lot on the
It can
internet.
happen.
Yeah, but I've also heard a lot of women say that they struggle to lose weight
Mm,
because of PCOS, of which I think recently I saw a woman say because she's been struggling with PCOS, she's gonna go and do some liposuction just to work on it because she's not able to lose weight. So why is it easy for some people to lose weight? And why do some women struggle
mm.
with it as well?
So if we go back to the fact that PCOS is a endocrine condition, one thing that um, gets affected is that you get insulin resistance. So when you get insulin resistance, this affects how you um, uh, uh, this can affect your weight specifically. I won't go into the science, but you, you may find you can really struggle with trying to lose weight. So particularly for those conditions, we may start drugs, but that's not going to necessarily reverse the weight. So this is why we talk about whether you want to have medical treatment for weight loss, um, bariatric treatment for bariatric surgery, meaning stuff like liposuction. Liposuction isn't bariatric surgery, sorry. Bariatric surgery, like maybe a gastric bypass or something that's going to have a long term way to manage the weight. Liposuction isn't a long term treatment for weight problems,
Mm.
especially when it comes to PCOS.
Yeah. You know, when you talked about healthy diets, what your version of healthy might be different from my version of
Mm.
healthy. But from a medical standpoint, what sort of things should we take and should we avoid for anyone who is going through endometriosis or PCOS?
There's a lot of diet. So this is particularly the field of dietitians, and there are particular diets that you can go on for PCOS. Uh, um, I'm not particularly versed in the particular diets that are specific,
Mm,
but making sure that you're eating your fruits and vegetables, you are having carbs, but you're not eating too much of one thing. Does that
mm,
make sense? It's always about a balance.
yeah,
Not eating too much sugar, especially when you're
yeah,
insulin resistant and you can't break down that sugar. Um, yeah, so that's what I mean by a healthy diet. So it's not particularly specific foods,
yeah,
but it's about having a balance across the board in terms of what you eat.
yeah. Because based on the survey that my team conducted, most people here believe that you should completely cut off carb from your diet and sugar as well. So I'm thinking, I think the end product of carbs is like glucose and all of
Mm.
that. So since people who go through these conditions, they're insulin resistant, do they like completely say no to anything carbohydrate, anything sweet, and just stick to like lots of veggies and fruits and
Um, if we kind of look at these as uh, there's a room for dietitians, as I said, but there's always natural remedies. And for some women, this may work. They may take away carbs and that works. But these are particular diets. There isn't a specific diet that's going to help PCOS. Does that
mm,
make sense?
mm,
So, a prime example, cutting out carbs may be like a keto diet. That there isn't evidence to say that a keto diet is best for PCOS, as far as I'm aware. But as I said, I'm not a dietitian, so that's not my field of medicine.
Yeah, that is really interesting. I love that angle because I mean, I have a lot of friends, they're like, no, I'm not taking any carb, I'm not taking any big thing. They just like, I don't want to say they're starving themselves, but
Mm.
they just run away from it and they just stick to like fish,
Hmm.
veggies, and the rest of it because there's been like a lot of meat around it. And something else that struck me, like in the survey, was most people feel that
Mm.
they are not fully supported in their workplace, school, or community,
Mm.
and they struggle with this. Why do you think this is happening?
So we kind of live in a capitalistic society,
Okay.
and kind of have to think about it like a company needs to run, and therefore you will in your workplace have one would hope that you have a policy about sick leave,
Mm,
which is normal, but is also being aware of what will trigger termination based on taking too much sick leave.
yeah. So how do we imbibe? I mean, it's not our organization, but how do we see that we have a culture, a work environment that fully supports women that go through these conditions? Because I mean, you can be sick or going through that excruciating pain and wanting to perform your best at work.
Yeah.
How do we create that level of awareness? How do we exercise more compassion to women out there? How do we get to do
Mm.
that so that they feel
Mm.
supported?
I would say if you are suffering, get treatment. Um, as a clinician, I see a lot of women who who refuse treatment, and I'm wondering, why have you come to me? Unfortunately, I haven't talked about all the treatment, but I only have a uh selective treatments that I can offer you. But if you don't want anything, then there's nothing I can do for you. Does
Yeah,
that make sense? And so it's about thinking, actually, do I want to have a improved quality of life, or do I want to, because for some women that's just normal for them and they are happy to go ahead and treat that. And if that's what you want, that's what you want. But if you are really suffering, get treatment.
Mm. Like when you talk about get treatment in some parts of the world, especially like in third world
Hmm.
countries, there are not like a lot of treatment options for women that go through this condition. So I think it's quite hard to actually really get proper treatment. And some women feel like it takes a long time for them to even get
Diagnosed.
diagnosis of what is going on with them.
Mm. I think there's lots of awareness in terms of um, if we looked at years back, people will wait long time before getting a diagnosis of conditions like endometriosis, particularly, um, because one of the things is that we don't diagnose these conditions in childhood, even if you have similar symptoms, because, as I said, that childhood period when you're just starting your periods is um, a new kind of phase of life. So we don't try to overly. It's not to say that we don't give treatment during childhood. We do,
Mm,
but we wouldn't diagnose these conditions in childhood.
mm.
But going back to your question,
Yeah.
I would say, especially when it comes to family members, it's very important to be very supportive to, let's say, husband and wife, be supportive to your partner, not just husbands, but partners. Being supportive to your partner is very important,
Mm,
especially through their menstrual cycle. Um, being there for them and also being an advocate for your family member. If you're seeing your family member suffer, be that good ear that tells them, no, please go and see a doctor. Um, don't suffer in silence.
mm.
Um, it's very important that we as family members be compassionate. We and family members be supportive arms when people go to hospitals, go to see their GPs, because the psychological impact of having support is very important. We're not supposed to be very alone beings. We're supposed to be in a community. So it's very important that um, those who are around you are supportive.
Okay. So in your years of experience, what's that one question that women often ask you that signals to you that they've been suffering for so long?
Um, Usually, when we see people in clinic, we ask you how long is your symptoms going on, and if it's going on for a long period of time, we are going to take you seriously. We're not going to fob you off. Um, is there a particular thing that I would say that alerts me that mm, uh, when I was talking about the signs and the symptoms, if you say those kind of things, yes, that will alert me to do more investigations. It doesn't necessarily mean you'll get a diagnosis, but at least you will get investigations.
Okay. So are there like symptoms that women, often mistake for stress or lifestyle changes that are actually issues regarding to their hormone or reproductive health?
Um, I'll start. You know yourself best, and yes, stress can impact you. If you, as I said, I give myself as an example. I know that stress affects my period. So know that, okay, that's stress induced. But if, let's say, tomorrow I am now completely having to buy completely new sanitary wear, I'm going to be like, okay, that's not normal. I might give it like a month, 2 months to see, does it return back to normal? Maybe it was just a one off.
Mm.
But if this is something that's continuing 3 months, 4 months, that's not normal.
Interesting. So, for every woman out there who is currently going through
Mm,
endometriosis or PCOS or any other
mm.
silent struggle, how do we practice practice self-compassion while managing conditions that, change our appearance? Because you've mentioned some women having facial hairs,
Mm,
some women are overweight. How do we get to be more compassionate with ourselves? Because some women could even go into reckless, like, I don't feel like myself anymore.
mm. I think it sounds very simple, but we should be kind to each other. Does that make sense? You don't know what someone else is going through, so it's very important to not have judging um judgment. Yes, these conditions comes with um someone may look like someone with PCOS. Um, someone doesn't necessarily look like someone with endometriosis, but you can see a person and you can particularly look by PCO, you have PCOS. However, there are treatments available even for extra hair. There's treatment available for acne on your skin.
Mm.
So it's not just treating the condition. The aim of medicine is to treat symptoms. Does
Yeah.
that make sense? So if you have hair, there is treatment for that. If you have acne, there's treatment for
Yeah,
that.
but not every woman out there could actually afford
Treatment.
treatment
Mm.
for it, right? And, you know, how do we like, what's the link between PCOS and endometriosis with anxiety or depression?
Yes. So if we look at anyone who gets diagnosed with a chronic condition, there's always an effect on you psychologically
Yeah.
because no one wants to have sickness. No one wants to be ill, especially be labeled with a condition that has a no cure. Um, if we look at PCOS, there is increased rates of anxiety, depression. This is why it's important that you do have a support system. You do seek help, especially if you're really struggling mentally. Um, that's why there are clinicians.
Hmm. So what should women know about these conditions as they age?
Uh, so if, as I said, majority of these conditions will get better once you've gone through the change menopause, but it doesn't necessarily mean it completely stops. So for majority of women, because the hormones go considerably low, their condition gets better because it's the hormones that is the leading cause for your symptoms.
Hmm.
Um, however, for some women, as I said, there isn't a particular treatment or cure that will say, okay, if we do this, it means you're gonna completely have no symptoms.
Hmm.
So some women will get, let's say, endometriosis. They may get hysterectomy.
What's hysterectomy?
That means removal of your womb. Sorry. So if your womb is removed, that might stop your period issues. So you're not getting heavy periods. You're
Mm.
not getting painful periods. But let's say you have endometriosis, it may not um you may still get that same endometriosis symptoms like tummy pain that you have because once your ovaries are still there, there's still something that feeds, the hormones are still there to feed the condition.
Mm.
And even if we remove the ovaries, depending on the degree of the disease, um, endometriosis can be lifelong. Uh, There's no way for us to say, is this woman going to get it? Is that woman not going to? It's only by you telling us your symptoms would we know um, what you have.
So does managing these conditions early change its outcome later in life? Like getting a diagnosis early, receiving treatment early, does it actually change its outcomes later in life?
Yes, particularly for PCOS, the earlier in life you get diagnosed, then you can start to put in the lifestyle changes and stuff like that so that you reduce your risk of heart disease, type 2 diabetes, risk of cancer, and so forth. Even with endometriosis, And if you want to have children, you have that earlier rather than later. Um, for endometriosis, the same applies. Um, by doing those lifestyle changes, you not only more likely to treat any overlying conditions
Mm,
that can impact your endometriosis. So, if I just look at the weight, if you are someone that has endometriosis and you are overweight,
mm,
that can have an impact because we have now added another condition. Does that make sense?
mm. Yeah, that makes a lot of
Mm.
sense. That makes a lot of sense. And I was going to ask you, so how can like medical institutions do better when it comes to listening to women? Because some women feel that they've been dismissed. You go to
Mm.
the hospital and they'll pretty much give you like painkillers, paracetamol, and say to you, you're fine. So how can medical
Mm.
institutions do better to support women?
I would say it's interesting. I guess because I work clinically. Um, uh, I would say if we really think, not if we really think, but if we um we hear your story, I wouldn't say that when there are doctors with all professions, there's got to be good doctors, there's got to be bad doctors, of course,
Mhm.
and there got to be people who would dismiss you even when you have a particular condition, because we all the level of competency is different for each person. um I would All I can say to that is that if you um feel fobbed off, seek a second opinion. um yes, we may give you paracetamol, but the least that we would do is that if you're having periods, you go see your GP. Your GP will treat you. Your GP is your first point of call that will treat you. But if your GP has got to the end of what they can treat in the community, that's when they refer on to us.
Oh, okay. That's a really interesting angle to look at this
Mm.
from. But I'd ask you, like, what's one thing you wish every woman knew about her body?
I would say is you need to know your body. There you there's always going to be a number of people who don't know themselves, meaning you don't know what is normal for you. Um or you're not very self-aware,
Mm,
and therefore and there's always a room for when you don't have the knowledge,
yeah,
then you won't know that it's abnormal. Does that make sense?
yeah.
This is why watching programs like this, or even reading a book, those are ways to improve your knowledge so that you are not suffering in silence.
So, for every young woman out there who is
Mm.
currently listening to us now, how can she start advocating for herself and for her general reproductive health?
Yes, get knowledge, read books. We're um in society,
Mm,
we have lots of information online. Get information from really good sources. So
mm,
I would say the Royal College of Obstetric and Gynecologists, when it comes
yeah.
to the UK, have lots of patient information leaflets that you can read about specific conditions. That's a good way to start. Um, Other countries also have similar societies like the Royal College of Obstetric and Society that release patient information leaflets. Particular hospitals also have their own patient information leaflets that you can read. Um, there are lots of medical societies that you can look up to find out more information.
Yeah.
Um, so get information, get knowledge, and therefore, once you get knowledge, then I wouldn't say Google your conditions. That's like the worst thing that you can do.
Yeah.
Um, but once you get some knowledge, you will then know, oh, actually, what I thought was normal, for example, oh, I've always taken 2 days of my period, I stayed at home and not go to school. Because you've heard someone else say, oh, actually, I got a diagnosis of that. That That's knowledge. Does that make sense? So use the social media to your advantage. Beware that there are people who are fakes out there who give fake information. So it's about
Mm,
getting it from reputable sources. Um, Starting somewhere. I think starting small, and that's how you're going to know, that's how you're going to be able to advocate for yourself. Um, Clinically, I can see the people who have got that information and they know how to advocate for themselves. And I can see that there's people who abuse the system because they easily get information. But it's very important that you advocate for yourself, because you're the best person that can advocate for yourself.
mm. That is a really, really fantastic perspective. So, if you're going to believe it, one young woman out there
Mhm.
with a mindset tip about her reproductive health, what would that be?
Um, I know it said that, we're seeing a rise of motherhood in later life, but having your children earlier, especially when you have conditions, is always going to be better. The older we get, unfortunately, the body does get weaker.
Yeah,
So the earlier you are, be proactive with your reproduction,
yeah.
with your reproductive health, rather than just be laissez-faire. That's what I would say.
Thank you so much, Dr. Tayo. This has really been a very insightful section, and I have learned a lot of things. And I know that our
Mm.
viewers out there, you have learned a lot of things from the knowledge Dr. Tayo has shared with us. And I believe that after listening to her, there is one or two things that you would be implementing. So if this section really resonated with you, you learned one or two things, please give us a like, a thumbs up, and subscribe. Also, share this message with other young women out there who may not really understand what is normal for them and what is not normal. And always remember that the shift starts with your mindset.
Mm.
So, see you again. Thank you. And thank you, Dr. Tayo. Nice to have you here today.
Thank you for having me.
Thank you.